Hi, everybody. Today is the first activity of Ege University Nursing Community International Relationship Coordination. Our topic is about fundamental nursing. I hope we learn many questions and nursing skills today. Firstly, I will open our video. I will share my screen.
Hi, I'm Terry Stone, a faculty member in the nursing department, and welcome to Fundamentals of Nursing Simulation Lab. As a student in the Fundamentals of Nursing class, you will experience your first clinical course towards your Bachelor of Science degree in nursing. Our class consists of lecture content, weekly on-site clinical at local agencies, and a weekly 4-hour simulation lab. Our simulation experiences bridge the gap between understanding lecture content and on-site patient clinicals by creating experiences in our simulation labs. This enables students to feel comfortable as they learn new skills. Emphasizing safe care practices and fostering communication is a priority. You will work with state-of-the-art, high-fidelity patient simulators and static mannequins. Experienced faculty, specially trained in the use of patient simulation, facilitate student experiences. You will gain confidence and grow as the semester progresses through teamwork and hands-on learning. Come and be a part of this hands-on class and exciting career.
I am the simulation lab coordinator here at SC4. I have the privilege of working with every student that comes through the nursing program. They come here for a simulation experience. They get to do all kinds of different scenarios that they don't get in the hospital setting.
Students come in here for the first time not knowing what to expect. You see the learning process take place here in the simulation, and it's quite fascinating. We can give blood transfusions, we can take pulses, check heart and lung sounds, have C-sections on our birthing mother, hook up IVs, we can actually give injections into the patient of medication. So we've come like leaps and bounds.
I love students, I love seeing them grow, and they would love me to be here 100 hours a week and do some with them. They can make mistakes here. It's a great learning tool. If they forget to do something, they'll never forget to do that again.
If you were to take all your learning outside of the classroom and not in simulation, you may not experience or see everything in that amount of time that you're in school. The more realistic we can make the training and simulation and actually be able to go through a scenario so that you can learn it, go out into the real world and know what to do in those instances and circumstances.
Once you're in the program, you will do fundamentals in a nursing home setting, and then they go to the hospital after that. Our students are well known. We had a student last year graduate, and she got a position down in Cleveland Clinic, and they knew about SE4 students, how good they were. So it's awesome to hear that.
I could see in the future these mannequins being able to maybe move their eyes. When you walk in, they can actually trace you as you walk across the room. They can wake up when you walk in the room. They'll be able to maybe even talk, ask you questions before you ask them a question.
After they graduate with their associate's degree, they have many options. They can go back for their bachelor's degree in nursing, and some of our students bypass their bachelor's and go right and get their master's degree. I love my job. I love students. I love seeing them grow. So that's why I'm a nurse educator.
Okay, I will open my presentation. Fundamental skill nursing questions. Fundamentals of nursing introduce you to true assessment of patients, the nursing process, communication between nurse and patients, cultural differences, functional health patterns, and overall framework of nursing practice. All the basic nursing skills, attention to detail, critical thinking, and decisions-making skills, written and verbal communication skills, and to desire to continue acquire knowledge are necessary for the nurses at every level to provide basic nursing care. Let's see the questions and think about the answers. The first one is, the nurse calculates the body mass index for 18 for a young adult woman who comes to physician's office for a college physical. The patient is considered average, obese, overweight, or underweight. Answer is underweight because for adults, the MBI should range between 20 and 25. MBI less than 20 is considered underweight. MBI is 25 to 29 is overweight, and MBI greater than 30 is considered obese. The other question is, a nursing student is preparing an administration and intramuscular injection to an infant. The nurse preceptor instructs the student to use which injection site: deltoids, dorsogluteal, trapezoids, and vastus lateralis. The answer is vastus lateralis, because the vastus lateralis is the preferred site for infants and children because of its safety. The risk of injury to an artery to nerve is low. It is located on the anterior lateral aspects of the tin between the greater trochanter and the knee. The other question is, which of the following statements written by the nurse should be documented in the subjective findings of patient record? Abdominal is not tender open palpation. Blood pressure is 122 to 68. Skin is warm, pink, and dry. The patient states pain is a 5 on 1 to 5 scale. The answer is D, because subjective documentation includes that which the patient states or describe, including a stated pain level or a report that the abdomen feels tender, uncomfortable when palpated. And fourth question is, for patients all require the attention of the nurse. Who should the nurse see first? Think about it. 12-year-olds with asthma asking to ambulate. 15-year-olds post-op patient complain of continuous neck pain. 60-year-olds with pneumothorax complaining of shortness of breath. And 8-year-old waiting to be discharged. The answer is C. Explanation, because a patient with pneumothorax who is experiencing shortness of breath needs immediate attention to prevent respiratory feature or other negative outcomes. The patient will comprise oxygenation should be the priority. The fifth question, which of the following best describe the goal of discharge planning and education? Ensuring the patient's long-term dependence on the hospital, increasing the hospital stays to improve patient outcomes, preventing the need for primary care, teaching the patient how to care for themselves. The answer is D, because Discharge planning and education is aimed at teaching self-care in preparation for the patient's translation from the hospital settings to home or long-term care facilities. This is beneficial because it reduces the likelihood or readmission. And the sixth question is, during a hospital fire, the nurse rescues the patients in immediate danger and activates the alarm. When following protocol, which of the following are included in the next step? Close all the doors, close all windows, evacuate the building, exhausting the fire, turn off the unit's oxygen. Multiple choices question, A, B, E. The nurse should confine the fire by closing all windows and doors and turning off the oxygen for evacuation. Raise. R, rescue patient in immediate danger. A, alarm. C, confine the fire. E, exhausting the fire if small and evacuate if the fire is too large. The seventh question, a nurse caring for 8-year-old with HIV is having trouble reading the dosage on the medication order. What should the nurse do? Ask another nurse if they can read it. Ask the patient what dose they normally take. Call the physician to clarify the order. Look up the dosage in the drug index. And the answer is C. To prevent medication errors, the physical should be contacted in order to clarify the correct dose. A drug index will give common doses or range of doses, not the specific dose the physician wants. The sixth question is, the nurse is assessing her patient for pain. The nurse recognizes the pain as chronic because of the presence of decreased concentration, diaphoresis, poor sleep and chronic feature, social withdrawal, tachycardia, multiple choice question. And the answer is A, C, D. Because acute pain is often accompanied by tachycardia, increased or decreased blood pressure, diaphoresis, tachypnea, and focusing on the pain. Chronic pain is often accompanied by depression, social withdrawal, change in appetites, restricted activity, decreased concentration, and poor sleep. And the ninth question, what is the most effective method to identify early breast cancer lumps? Mammography every 3 years, yearly checkups performed by physicians, ultrasounds every 3 years, monthly breast self-examination. And the answer is D, because monthly breast self-examination has been shown to be most effective method for early detection of breast cancer. Approximately 95% of lumps are detected by women themselves. And the last question. Alzheimer's patient incontinent of urine during the night times. The nursing care includes which is more correct. Offers bedpan every 2 hours, limit fluids during evening times, Foley's catheter, IV intravenous fluids. The answer is B. Limit fluids during evening times, specific intervention for Alzheimer's silence with urinary incontinence. Sometimes the silence forgets where the bedroom is located. having bright lights or frequently taking the silence, there may be help control incontinence. Fluid intake after the dinner meal can be restricted to maintain continence during the night. Thank you for your attention. We have a code games also. I want you to enter the PIN. I will share my screen. Please enter the game PIN, please. I will wait all of you. Are you ready? Let's get started. First question. Which of the following is the best example of an appropriate patient-centered nursing goal? Yes, true. Which of the following best describes the goal of discharge planning and education? Yes, teaching the patient how to care for themselves. Other question. On the following, which intervention would be the highest priority before continuing an IV line? Determine if the silent can tolerate oral fluids. The fourth question, multi-choice. You can select one more time. The nurse is discontinued the central venous catheter. Which of the following steps should be taken? Yes, both of them is correct. Fifth one, a nurse administering blood products should keep the infusion time under. Yes, 4 hours. True. The sixth question, the nurse is administering an insulin injection. The nurse dedicates the bedside for this type of injection is. Abdomen. True. Seventh question. Which of the following intervention takes priority when a nurse is ending the shift? Yes, finish documenting the intervention and care provided during the shift. Other question. A physician order reads furosemide, 40 milligram IV daily, times 4 days. Which type of medication order is this? Standard writing order, true. Last two questions. Which is the correct order of the steps in nursing process? Assessment, diagnosis, planning, implementation, and evaluation. And the last question. When giving an intramuscular influenza vaccine, the nurse should insert the needle at what age? Intramuscular. True, 90 degree. All the questions are common questions. Who will win? Congrats, Damlacığım. Thank you for your attention. See you next Thursday.